Today is Thursday, January 14th. We're only a week out from Flex Day. And I am meeting today with Dr. Ronald McKinley, who is the acting Vice Chancellor of Human Resources and Employee Relations. And first, I want to welcome you to Peralta.
Well, thank you very
And
much. I'm excited to be here.
I'm wondering if you might share just a quick background and tell us a little bit about how you arrived here at the Peralta Colleges to work with us.
Sure. So I arrived, I had retired from the University of Texas Medical Branch in 2019. And that university, it's a health sciences university. It's part of the University of Texas system. About 14,000 employees, 1,000 faculty, core schools, medicine, nursing, allied health professionals, and we have a graduate school biomedical sciences, where we created PhD scientists to work in in the biomedical field. So I had one full-time appointment, two part-time appointments. I was the vice president and chief human resources officer. That was full-time. Part-time, I was vice president and chief standards officer. We were developing, and I'm still working on these things, standards, international standards with the International Organization for Standardization with regard to human resource management, and also for healthcare organization management. And my other part-time appointment was associate professor in the School of Medicine as associate professor, preventive health and community medicine, preventive medicine and community health, and where I taught in the MHA, Master of Healthcare Administration program. And I got here because when I retired, I signed up with a couple of organizations, one in higher education and one in healthcare, to be an interim executive, chief human resources executive. And about a year after I'd signed up with them, I got a phone call from them, and then I found myself working remotely from Tennessee, Knoxville, Tennessee, and living on Pacific Standard Time. So that's how I got here. That's it in a nutshell.
Now, just because you already explained this to me, but some viewers might wonder, what are those lovely blue flowers behind you? What's the significance?
All right, so I'm a native Texan, and these are Texas bluebonnets. They are the state flower, and as you can see, they're quite pretty. And in the spring, if there's rain, there's not always rain, but if there's rain, the fields are just really bright blue with these lovely flowers. So
That's
thanks for
amazing.
asking.
They're really beautiful. Okay, so just briefly, I'm glad that we're here because I think people will be pleased to meet you, to learn that you're here for a while to help us stabilize. I'm wondering if you could share with our community just maybe 2 or 3 of the priorities that you feel you'll be able to work on with our team. Yesterday, I interviewed Antoine Meole, and he told us a lot about the IT upgrade, which
Right.
may impact HR. So not so much the technical component, but what are some of the sort of functional things that you're working on and hope to achieve and help Peralta achieve while you're here with us?
All right, so I have a couple that I can talk about very quickly. And of course, we're all living the COVID-19 pandemic, right? Unfortunately. And so hopefully 2021 is better than 2020. That's something I think would be important for us. But we are working on a plan to help to ensure that we have a safe and healthy workplace, especially with regard to when folks start returning to campus. We have the board in its last meeting approved a contract with an organization that will provide services for us with regard to COVID-19 screening, so that folks will be screened when they come to our campuses. And that will also include where it's appropriate and where it's indicated. And of course, when the person agrees to that, because it also is relative to their private healthcare information, then there will be a rapid smell test that will be available to folks. We know from pretty good research that the evidence suggests strongly that 75% to 85% of everyone who has actually contracted COVID-19 has an impairment with regard to their smell and taste, and that these symptoms express themselves first before anything else, before fever, before colds and chills and those types of things, coughs and what have you. So for where it's indicated, we will provide a smell test, so we will know immediately whether or not the person whether it indicates that they have contracted or come in contact with COVID-19. And if so, then we will refer them to the gold standard deep nasal test, which will also be provided free of charge to them. So I think that's exciting. We also are, talking about what we can do with regard to vaccinations, COVID-19 vaccinations, and those types of things. So I think that's probably on top of mind awareness, given our cold purple, category right now that we find ourselves in, in the Bay Area. So with regard to PeopleSoft, I have implemented, improved, worked with, used PeopleSoft for a very long time. I mean, like long time. And we have a lot of work to do because we are just now beginning to use some of the functionality that exists in PeopleSoft. It's not an inexpensive endeavor. We have the HR suite, the human capital management suite, which means we have all of the modules that are available with Oracle PeopleSoft. However, we of course have not turned all of them on because that is a longer process. And one of the things that we need to do, and we hope to get done in the not too distant future, is really prioritize which modules do we really need to have now, and to come up with a timeline to begin to turn on and use those modules in some kind of a reasonably strategic order that enables us to gain more and more functionality that's available to us in PeopleSoft. Is that so? Those are, and then of course we have all of the labor contracts are up for either reopening or it's time to negotiate them, because we have, like, the SEIU is out of contract and we need to do something with that. So we are beginning to do our strategic work at working with the unions and with to comprise our teams, negotiating teams with regard to that. So that, and all of those seem to be going to happen pretty much about the same time, and also in the not too distant future.
Excellent. There's one question I'd love to ask you that's a very specific one.
Sure.
I'm, as you know, the staff development officer. I prefer to say staff development coordinator.
Okay.
And right now there's a statewide California community college system called the Vision Resource Center, which creates accounts and people can do and log professional development there. And we've really hoped to be able to use that system as kind of an overarching system for our professional development. We haven't been able to because PeopleSoft wasn't upgraded. Once it is upgraded, that will become an opportunity for us. And it will require the collaboration of IT, the Office of Staff Development, Vice Chancellor Siri Brown, Dr. Siri Brown in Academic Affairs, and your office as well, because it begins to bring all those things together and streamline that process. So I hope that, I'm not asking you to make that a priority necessarily. I know there are lots of priorities, but I'm just excited about that option.
Right now, I'm not familiar with that particular program you're talking about. So it integrates with PeopleSoft?
Yes,
That's
yes.
right.
So it logs the participation, the activities, badges, professional badges. It basically comes a place, and then our system can download those data so that faculty can demonstrate that they have met their obligation, and staff can record participation in professional development.
So would you consider this then to be in the category of a learning management system? Is that what it is?
It's not actually a learning management system. It might be similar. You and I could speak offline when you have time, and I could show
I'd be
you
very
a little
interested.
more about it.
I'd be absolutely very interested in doing that. So
yes, yeah. Faculty are excited about it, and we do have an obligation by contract to continue professional development, as we should, and most people want to. But we also have an obligation to record that accurately for the state of California, and that's the part we struggle with right now.
okay,
So,
all right. Well,
yeah.
so we need a place that we can do that in an
Yep,
efficient
yep.
way. Yeah. Well, I very much look forward to speaking with you about that.
Yeah.
Okay.
Is there anything else you would like faculty, staff, administrators who may not have met you yet to know? Anything you've learned since being here? Yeah, any final thoughts?
Well, that's a very good question. All the questions have been good, so that's I'm not saying that, but so there's a lot going on. And I think that's a very large understatement, if you will. There's a great deal going on. There are lots of moving parts. All of us are struggling a little bit with regard to having to work from, doing a distributed workforce when we really have not done that in the past. Most folks have not done that, at least not full time, right? Maybe occasionally you're doing things from, as a distributed approach. However, it does make things more difficult. It makes communication more difficult. It makes coordination and all of those types of things. And of course, we know that all of us being human beings, if we lack certain communications, we often, imagine what it is just based on our own experience and what we think might be going on in the world. So I would encourage all of us to reach out to others as much as possible, to communicate as often as possible using Zoom, the telephone, other safe means of interacting with each other to ensure that there is really less misunderstanding about what the priorities of the district are, what is going on. Because like I said before, all of us as human beings, if we don't have information, we fill the blanks in with our own stuff, right? And if we don't do that, we're not human. So, but it would be helpful for us to do that and to, kind of look forward to the time when we can actually be in closer proximity with each other and have some return to what we used to call normal, normal life, right? In the world on planet Earth. So I hope that answers your question.
It does. And of course, however hard it is for us as an institution,
Right.
we do have a lot of resources. They may be imperfect, but we have, laptops, and most of us have internet and things. And however hard it is for us, it's that much more difficult for our students.
Absolutely.
So,
Yeah.
And obviously that's the reason we're here. So
That's the only reason the place exists, right?
Yeah. I really appreciate you making the time this morning. And I think that this recording and your comments will be super helpful for people to get to know you, know a little bit about what's going on. And you and I can connect down the road when there's room to talk about the vision resource. And if there's any other way as a staff development coordinator that I can help the Office of Human Resources, let me know.
All right. And if I may say just one other last thing, that I'm very accessible. So if folks have questions, please do not hesitate to send me an email. I will respond. I may not respond immediately, right? But because I do get lots of emails. I was remarking to the chancellor the other day on a phone call that I said, you hear all that dinging going on? Ding, ding, ding. I am not in Las Vegas playing slot machines. Those are emails coming in. But I would be very happy to do it. And I also want to thank you very much for asking me to be part of this Flex Day.
Dr. McKinley, thank you so much for spending some time with us this morning.